So our agenda for today is to talk about or determine the skate park repair bid, contract with Platte River Networks for IT support, school resource officer agreement, and a presentation from the Lake County Community Fund and Peak Alliance. And then we have minutes for our regular meetings to approve as well. And so with that, we'll go ahead and get started. So for number one, we have the skate park repair and award bid award. So Amber, I will turn it over to you. Do you have a recommendation on this?
Commissioner Marcella, this is Commissioner Mudge.
Oh, sorry, go ahead.
That's okay. Real quick, I just the PRN contract, we were not able to connect and speak with legal to go through some of the questions that were raised in our meeting on Monday. So if we can push that to one of our next regular meetings, that would be great. And I will put the agenda in the chat. I also I know we're not there yet, but I have only gone through about half the minutes. So I apologize for that and am not prepared on those either.
Okay. Sounds good. Commissioner Glenn, did you have an opportunity to go through those?
Yes, I did, and they seem to be fine with me.
All right, thank you. Okay, so with that, we'll go ahead and go through with number one. So Amber, if you would like to walk us through what your recommendation on the skate park bids would be, that would be great.
So I apologize, Kayla. I don't have a recommendation. I was under the impression after our meeting on Monday or Tuesday that the BOCC and Michael Irwin and possibly the maintenance department were going to look at those a little closer to help make that determination. So I have not done anything further with those bids.
Okay, so I've gone through them and determined what the lowest bidder is, but I wasn't sure if that was an appropriate way for us to choose this bid based on the scope of work, because I'm not sure. I think I would rely on your expertise to assist with that determination. Commissioner Mudge and Commissioner Glenn, do you have any thoughts of going through these after going through these bids?
I was not able to connect either with Amber or Michael Irwin at Public Works either. So I apologize.
Okay. Commissioner Glenn, what about you?
I don't have any concerns at this point.
Okay. Did you have an opportunity to go through the bids for the skate park and have any questions on those at this point?
No, I did not.
Okay. So Amber, it sounds like between the three of us, we might need a little more expertise on choosing the appropriate bid for the scope of work that you're looking for. And I had only looked at them based on cost rather than qualification. So do you have a recommendation of how you'd like us to select this?
I really don't. This is far outside of my area of expertise. Okay. I don't feel comfortable making that determination either. I don't know anything about skate park repairs or concrete work or any of those things. So I'm happy to gather whoever you think is best to help make this decision or ask these vendors particular questions, but this is not, again, I was really just trying to be helpful in getting the ball rolling on this project. Yeah. And I just don't, again, not my area of expertise either, so.
Okay.
I think the only couple questions I had in looking over that briefly was, comparing and looking at that, like you had noted, Amber, the level of interest and then the mobilization and whether they were going to be in the area. And I was more curious too, to better understand if this type of work on like rec facilities was something that they were experienced with. It seems that, let's see, had you told us the last time that only one of them came out to see it, or have any of them come out to see the facility?
No,
person?
no one has done a site visit. They're all out of state. So I have
Okay.
FaceTimed and or sent photos
Yeah.
to them.
Okay. Okay. All right. I think,
Oh, sorry, Sarah.
no, it's all right. I was just gonna say, I think we need a little more time than making a decision today. I
Okay.
think.
I think so too. Amber, I had seen though in the bids that you had sent us that Hunger Skate Parks is an offshoot of Native Skate Parks. What's the close relation there? Is it like a former employee that created a company out of Native Skate Parks?
Yeah, so Native Skate Parks is now defunct, and these are former employees of that company that have created their own.
Okay. And so are they familiar with the park itself then?
I don't know if those folks that started that company were here and did the site work. I don't believe so, but.
Okay. Cool, sounds good. Commissioner Mudge and Commissioner Glenn, I think our next step is to set up a work session with Amber and maybe Public Works to look at the facility and then compare the bids. What are your thoughts on that?
Sure. Why don't we, oh, sorry, I don't know if I'm unmuted. Yes, unmuted, sorry. Why don't we set that up, and maybe in that time frame we can also collect some questions that we'll reach out to each of those agencies with. Any further questions?
Okay.
Amber, did you follow up any of those with more clarifying questions?
No, because no one had asked any questions for me to follow up with.
Okay.
Awesome. So I have a scoring rubric that we can use to go through the bids individually, and then we can pick a time to have a work session and meet and look at the site and look at those bids with the site. Amber, would that be appropriate for you? What would be a time frame for you that we could do that, fit that into your schedule?
I think this really needs to be done pretty immediately because obviously no one's going to put us on their schedule until we make a determination.
Right.
And it's already July 9th. So we're going to run out of concrete appropriate weather here fairly shortly. So I think the sooner the better.
Okay. Commissioner Mudge and Commissioner Glenn, can I send you the scoring rubrics and we can meet and walk and hold a work session on Monday to go through these? Or Commissioner Mudge, would you just like to do that with Amber? What's most efficient for you?
Oh, I can schedule that time individually if you'd like. I also wonder if Amber could reach out to any of those companies and ask for just clarification on specific experience and referrals on this type of work for us in the meantime. And
Cool.
maybe, yeah.
So Amber, let me send you the scoring rubric I have, and then we can set something up offline for us to go through those bids and then make a determination to bring back to the board if that would work, Sarah and Mark.
Sounds good.
Okay. Commissioner Glenn, does that sound okay or appropriate with you?
Sounds fine.
Okay. So we'll do that, Amber. I'll connect with you right after this.
Okay.
Okay, so we'll move on to item number 2, which is the contract for Platte River Networks, and we've moved that off of the agenda as well. We have the school resource officer agreement. This is a ratification of this agreement. It's an agreement between the city and the county and the school district for the school resource officer. The school district and city and county have done this for how many years? Greg, how many years have we done this?
I'm sorry, what was the question?
How many years have we done the school resource officer?
It actually predates me, but probably about 5 or 6. And And then we had about a 2-year hiatus from the school resource officer, and now the IGA has been signed again for this
Okay.
year.
So I don't have any questions on the IGA commissioners. Do you have any questions? It's the same IGA that we had in place that was signed last year and agreed upon last year by the county and the city and the school district. Nothing's changed.
Nope, that sounds good. The budget remains the same as well.
Yes.
Great. And we have somebody in that position now?
Yes,
I have not
I believe
heard
so.
of-
Is that correct, Greg?
That is correct. He's actually been in place for quite some time, and he's been working closely with the school district this summer, getting ready for the fall, working with Mike and the and other district people to make
Okay.
sure they're ready in the fall.
Awesome.
Great. I'll move to approve the ratification of the school resource officer agreement for 2020.
Second. Okay, we have a motion and a second on the floor. Commissioner Glenn, do you have any further discussion about the school resource officer?
I do not.
All right, any further discussion, Commissioner Mudge?
Nope, thank you.
All right, seeing none, all those in favor? Aye.
Aye.
I
Wonderful, thank you. I'll get that taken care of. Next on our agenda is a presentation from Lake County Community Fund and Peak Alliance. And today with us, we have John McMurtry and Tamara. I don't know how to say your last name, Tamara.
It's Tamara Pogue.
Tamara Pogue. So they will give us a presentation on Peak Alliance. Greg Lobby from the city is here. I know that the city has engaged with them as well already. Is that correct, Greg?
Well, what we've done is we've agreed to help defray some of the costs they had in putting this together.
Okay.
And they've asked the same from the city and county. And the other part is we are now meeting with principals. The Peak Health Alliance isn't actually the health broker. They put the program together, and now we're going to deal with those brokers to see if it's a good fit for the city for our health insurance plan.
Awesome. Great. So with that, I'll hand it over and let you facilitate your presentation on behalf of the Peak Alliance.
Thank you all very much for scheduling us on the agenda, this special meeting. I just want to introduce Tamara Pogue, CEO of Peak Health Alliance, based in Summit County. And Peak Health Alliance is a nonprofit insurance purchasing collaborative. And we last fall were, as part of a grant request that we were putting together, we're looking at healthcare costs, health insurance costs in Lake County. We enlisted Peak Health Alliance to do some actuarial data analysis, look at data in Lake County. And Tamara has come up and her team with some very interesting data and favorable information for Lake County. They work on behalf of local residents, local businesses, but it's a wonderful project that she's put together. What we've requested is their expenses as a nonprofit to do this work for Lake County came to about $10,000. Freeport McMoran is going to donate to reimburse Peak Health Alliance $5,000. I've talked to Greg about the city pledging $2,500 and our request to the Lake County government of $2,500 to reimburse Peak Health Alliance for their time and resources to put this data together. So want to go ahead, Tamara, and welcome and thank you for your time.
Thank you for having me, commissioners. I appreciate being on the agenda today. And of course, Mayor, we always appreciate your continued support. As John was saying, Peak Health Alliance is a nonprofit purchasing collaborative, and as such, and we started in Summit County, to be clear, in response to continuing and mounting frustration over the high cost of health insurance premiums on the Western Slope. In Summit County, which is where I live, we were increasingly frustrated that we felt like we would trot down to Denver and testify on all kinds of healthcare legislation, and one of two things would happen. Either the bill wouldn't pass, or it would pass and actually make things worse. And so about 3 years ago now, we as a community funded by the Summit Foundation decided we would take a step back and see if we could find a way to navigate this problem locally. And so I think because largely most of us were nonprofit folks, we started with data, and we took all of the claims data for Summit County residents, which we have now done for Lake County residents. And we looked at 3 different factors. We looked at our prices compared to the Front Range. We looked at our prices in Summit County as a percentage of Medicare, not because we think that that's a methodology that particularly makes sense from a payment standpoint, but because it does give us an apples to apples way to understand how much we're paying. We also looked at how much care was staying local versus ending up on the Front Range. And what we found was very interesting. I mean, certainly it's no surprise our hospital in Summit County was charging an extraordinary amount of money for the services that our residents were receiving. So our ER visits, for example, in Summit County sat at about 850% of Medicare. Now, I would never argue that 100% of Medicare is what they should be charging, but certainly any profit margin that's at 850%, one has to question. The other, though, more interesting thing we found is that because of the high prices, our hospital was only seeing about 30% of the total claims volume that our residents needed. Another 40% was ending up in Denver. And another 20% or so was ending up in Eagle County. And so really from a shop local perspective, that didn't seem to make a whole lot of sense. And that out-migration, which is what we call that care in healthcare, really wasn't ending up in the Front Range because folks couldn't get the care locally. It was ending up in the Front Range because consumers had figured out that it was cheaper to go to Denver, as I know many of you also experience in Lake County. So armed with all of this data and representing our individual consumers and our small businesses and our large self-funded employers, we started negotiating with Centura, who owns our hospital in Summit County. And we now know that in that process, we were able to negotiate the best contract that Centura has offered any entity in Colorado. And what that really meant is in some cases, they were able to reduce their prices to our members by about 50%. So we take the fee schedule that we negotiate with the hospitals. We also negotiate fee schedules with independent providers in our communities because we want to make sure that those folks stay whole in this whole conversation. And then we also ended up doubling the reimbursement rates for behavioral health, outpatient behavioral health providers in Summit County, because we wanted, one of our goals, in addition to reducing the cost of premiums, was also to increase access to behavioral health. We take all these fee schedules and we basically bid them out to insurance companies. And we ask the insurance companies to compete against one another and to give us the math underneath their premium calculations so that we can make sure that all of the discounts that we've been able to negotiate on behalf of consumers actually go back to consumers by way of decreases in premiums rather than being kept by the insurance companies. So in Summit County, we have plans right now available on the individual market and the small group market, and we have 3 self-funded employers who are also members of PEAK. And that brings us to about 5,000 lives that are insured by a PEAK product. Just to give you a sense of scale, the largest insurer in Summit County prior to PEAK's work had about 2,500 lives. So we obviously have a great deal more ability to negotiate on behalf of consumers than an insurance company typically does. And at the end of that whole exercise in Summit County, premiums in Summit County are about 48 to 50% less this year on the individual market than they were last year. Now, not all of that is a result of PEAK. About 30% of that is the result of reinsurance, which, as you guys probably know, will remain in effect for 2021. But another 20% was really the result of the work that PEAK did to negotiate on behalf of our local residents. So over the course of last summer, as my board sort of post-mortemed all of this work, one of the things that we realized is that Summit County alone is too small of a county to have an impact on all of the aspects of the healthcare dollar, pharmaceuticals, for example. And so we decided that we would partner to replicate this work with any other county on the Western Slope that was interested. And so we were actually approached by John and the Chafee Community Fund last spring to begin this work, which we have now done on behalf of Lake County. And so at this point, we've selected Bright Health as our insurance carrier for Lake, Summit, and Grand counties. We also have 4 counties in the Southwest, but I think that is less important to the conversation today. And Bright will be offering individual products. They will be offering access for small businesses via something called an ICRA, which I can talk more about if you're interested. And then we are also able to share all of our fee schedules with larger self-funded employers. I do want to take a moment just to say, you know, St. Vincent's was probably the easiest hospital for us to work with. We are really grateful for their partnership. And so the fee schedules that Peak is able to offer to our insurance carriers and our self-funded employers are a partnership with St. Vincent's, a partnership with Centura, which includes St. Anthony's Summit Medical Center in Frisco, Children's, and UC Health. And so that's the sort of backbone of the network that Bright will be offering on the individual market for 2021. So once we've selected the carriers, insurance gets sold the same way it's always been sold. Folks go on to the individual market, they see our products, they're co-branded as Peak Health Alliance and Bright Health. Folks select the product, they can use their tax credit to pay for the product. We really don't, you know, we really call ourselves a market-based solution to healthcare. Because we're using a lot of the infrastructure that's already in place in the healthcare space. So I will stop there, but obviously Peak, in order to do this work in the counties where we've been asked to replicate the work, does incur costs in terms of buying the data, analyzing the data, negotiating with the providers, selecting the carrier, and implementing the plan. And so we are very grateful to the support that we've received from the City of Leadville and Freeport, and would be grateful for additional support from the county. And I'm happy to answer any questions you all have, because I know healthcare is a morass and it's really hard to go through it in 10 minutes or less.
I don't think I have any questions. I guess my question would be, right now, would we engage with you as an employer, or is this community-wide, or how does that work?
It is community-wide, and you certainly could engage with us as an employer. My understanding is that Lake County government is part of CTSI. We've not been able to figure out a way to work with CTSI, frankly, at this point, but certainly if you wanted to work with us on other options, we'd be happy to do so in conjunction with your broker or your staff, whichever process you prefer. But you could, as a self-funded employer, decide you wanted to work with the TPA to put our contracts into place for your employees and to see whether or not that would generate additional savings for you as an employer.
Okay, thank you. I don't know that I have any additional questions right now. Commissioner Mudge, Commissioner Glenn, do you have questions right now?
I'm just wondering, I mean, it sounds like you're continuing to seek counties, county by county partners into subscribing to your product, right? And Peak Alliance?
We don't really seek counties. If counties are interested in partnering with us, to the extent that we have the capacity to do so, we're willing to do so. You know, we're sort of having some conversations with some additional counties for 2022. We represent 8 counties on the Western Slope right now. But for us, the fact, you know, this process really needs to be led locally. Right? And so in all of the counties where we work, we have a local partner that really leads the work on the ground. And what we're really bringing to the table is the technical expertise for any county that wants to do this.
And so the work on the ground would be in Lake County. What next, I guess? Because it sounds like you ran all the numbers on our, out migration and such. Yeah.
So the work that the Lake County Community Fund and the City of Leadville have done so far, really connecting us with the hospital connecting us with your local providers to make sure that we have the contracts in place to have them in network. And then we ask the local community to help us with outreach. So certainly outreach to individuals in terms of accessing their health insurance on the individual market, outreach to brokers, outreach to small businesses, and then outreach to the larger employers. You know, our ability to continue to drive decreases in premiums is really about how many folks sign up to use the plans that we can offer. It's the number of lives that gives us the ability to negotiate. So this next phase of enrollment is very important to long-term success.
Mm-hmm. And so as a county, as a broad community engagement, just spreading that opportunity, I guess, to be a customer of yours, if you will. And it sounds like have we been able to reach out yet? Or, I mean, is that kind of where the buck stops as far as needing any further commitment to our larger employers? Does the hospital actually participate in this as well with their employees?
They could if they wanted to. We've not had a hospital sign up yet, but there are a couple that we're actually talking to about this at the moment. So certainly if St. Vincent's wanted to pursue this for their own employees, we'd be happy to have that conversation.
Mm-hmm. And as you get,
sorry.
No, that's okay. I was going to say, as you get more interest and more participation, do you then go back out to renegotiate, or that really, you know, what? I guess does that depend on kind of the next phase of the size of the organization?
That's a great question. So some of our contracts will have to be renegotiated. Our initial contract with Centura was a 2-year contract, so we'll need to renegotiate that this fall. And we'll do that. You know, our initial contract with St. Vincent's is a 1-year contract, and, you know, then we'll all revisit how it went, and if it worked for them, then we'll see if we can make it work again. But there are other longer term strategies that we're also going to pursue as we build more lives. Negotiating a better approach to pharmaceutical pricing is very high on our agenda, because when you break down the healthcare dollar, about 30% of it is the hospital, 40% of it is pharmaceuticals, and then there's everything else. And so figuring out how we really decrease that 40% that's due to pharmaceuticals is only something we can do if we have more, you know, an increasing number of lives. And so we'll, you know, as we finish enrollment for 2021, we'll begin thinking about that strategy. And then there's other things that we work on. Certainly behavioral health has been a big focus of ours. Outpatient behavior, all of our plans have outpatient behavioral health coverage, $25 copay plans in front of the deductible. We also, you know, have doubled the reimbursement rates for therapists, as I said. And so that meant in Summit County, prior to Peak's work, we had about 7 therapists that could bill insurance. Now we have about 40. So that also increases access for folks. You know, the most frustrating thing, as I'm sure you all know, is to buy an insurance product and then need therapy and not be able to afford therapy because you have a $13,000 deductible. So we've worked really hard to make that not the case for our communities moving forward.
And Tamara, do you, the information that you collected on, you know, the out migration to Denver, say, how much of that 40% for Summit County, I think you just recited Summit County statistics, yep. How much of that is due to the service only being provided in a Denver facility compared to access more yep. locally? And forgive me, I'm sure you covered this. I was trying to take my notes and I'm not super well versed in all of this in the industry here, but I mean, this would be your whole mission is to expand access, right? So we're not talking about, I guess maybe reiterate or
yep.
or say that again on what, you know, where folks could obtain healthcare.
Yep. So the answer to your first question is, of the 40% out migration from Summit County down to the Front Range, only about 10% really had to be at a higher level facility, right? Children's or UC Health. So there was really about a 30% percentage of our claims that we could try and reroute back to Summit County, which obviously, for hospitals, you have to manage that balance between price and utilization. And if as your utilization goes up, your price can go down. So that's what we had to work with. You see similar numbers, quite frankly, from in that dynamic between the Front Range, St. Anthony Summit Medical Center, and St. Vincent. So there is care that St. Vincent's is losing to both Frisco and the Front Range that we can keep back in Lake County. In terms of how people act, yes, you're right. Our whole goal is to increase access to insurance by making it more affordable. And so there's basically two ways that people access their insurance: through their employer or through the individual market. And both of those avenues are still available. So for small businesses who have not been able to afford insurance prior, they may be able to offer coverage to their employees that they've not been able to do in the past. And then for folks who have not been able to afford coverage on the individual market, the hope is that this makes it more affordable and that they can now afford it through the individual market.
Tamara, hi, my name is Lori. I am the HR director for Lake County. It sounds like to me that Peak is a pooling source to pool the small businesses together. Is that correct?
That is correct, although I always caution folks when they use that term. Traditionally in healthcare, when you talk about pooling, you're pooling risk. And we don't bear the risk for the employer or the individuals. That is still done by the third-party administrator or the carrier. What we do is pool the negotiating power of a community so that we can offer pricing to those risk-bearing entities. Does that make sense?
It does. How long has Peak been in business?
So the Peak's first year is in Summit County this year.
And what is the wheelhouse size of organization?
It doesn't matter. It really doesn't. We have a product for, now product's the wrong word, but we have an approach that we partner with, or an entity that we partner with for any size organization or business. It really depends on how they want to offer their healthcare.
And since this is your first year, what currently is the number of lives that you're handling?
Right now, we have just shy of 5,000 lives in Summit County. Our anticipation is that come 2021, that will increase to about 30,000.
And that's including dependents as well, correct?
Correct.
Do you focus on a specific industry?
No, again, we really are a community-based approach. And so we go community by community, and the goal really is to create relief for any purchaser, whether that's individual, small business, or large business, or government that wants to participate within that community.
Who is your biggest competitor?
We don't have a competitor. We really are here as a nonprofit on behalf of the communities that we represent. There's actually, we are the only purchasing alliance in the country that does work on behalf of individuals, small businesses, and large employers. Our model is completely different from any other entities.
So there's no other business, no other NPO that does anything like what you are currently doing?
No, the closest are really the alliances that represent self-funded employers. There are some of those across the country, but there is no other purchasing alliance that represents all three markets.
Would we have to, I know I'm not saying this quite right. Okay. Would we have to agree to participate for you to be able to further identify, any cost savings, or the real comparison for our organization as the county, or for large employers in the community like Melanzana or High Mountain Pies? Yeah. Have you identified kind of those cost benefits?
So it's going to depend on each, for the large employers, because you guys are typically self-funded or part of a trust, it really depends, your savings or lack thereof is really going to depend on your claims experience and where your folks access their healthcare and whether or not you want to encourage them to use a center or a facility or use St. Vincent's. Depending on your decisions around that, you will see more or less cost savings. And what I say to self-funded employers is, if this isn't a good deal for you, if this doesn't reduce your cost of healthcare as an employer, then you should not become a member of Peak. It doesn't make sense. Our goal is to produce cost savings. And if those don't exist for you as an employer or don't work for you as an employer, then you shouldn't stop doing what you're doing now. But we do, when we're working in a local community, it's often the large employers that have to think about not just their own employees, but the impact on the broader community. And so if there is a way that we can partner with you to make this work for you, that's obviously in everybody's best interest. But if there isn't, you shouldn't do it. Right? I mean, this isn't a typical healthcare conversation where a broker comes in and tries to sell you something. I'm not trying to sell you anything. This is something that we've been able to work out on behalf of Lake County residents. And our hope is that the decrease in individual and small group premiums that you see in Lake County next year is similar to what we've seen in Summit County this year, right? And that's great. But that's it, right? What happens from there is really up to you all as an employer.
Commissioners, I'd like to step in because I think there's a misconception about the point of this this program. And the first thing I would say is they've already done the groundwork, and they normally charge a county, to come in and do that groundwork and to renegotiate, as they already have, the healthcare cost. So that's done. They do have a cost of about $25,000 for Lake County, all of which is covered except for $2,500. And that's I believe that's exactly what they're asking the county commissioners for today. The city agreed about a month ago to participate in that, and we put up $2,500. They got a grant from Climax, and I'm not sure where the other money came from, but
that comes the Arnold Foundation and the Colorado Health Foundation.
Thank you.
Where the rest comes from. Mm-hmm.
I would also say the first time I ever heard about this was from Julie McCluskey. She was a big fan, and she was talking about, combined with reinsurance and then Peak Health Alliance, they were reducing costs to Summit County businesses and residents by about 40%. Huge cost difference, especially in the mountains where our costs are higher anyway. So we've been in support of it. We are now talking to actual providers, because Peak is not that provider of the healthcare policies, and we're in conversation with them now to find out if it is a proper fit for us.
So Lori, if you wanted to explore this, I'd be happy to chat with you directly about, who is your TPA, who's your broker, and whether or not this makes sense. But that really was not, my primary intention for today was not to focus on that.
Tamara, I appreciate that. I think it's a conversation that's premature at this point. It's something that I would need to speak with the commissioners about before we would move forward, unless they feel differently.
John, can you just clarify real quick that this work was done in Lake County and initiated on behalf of the Lake County Community Fund and Chaffey County Community Fund, correct?
Yes, it initially started as a part of a grant process that we wanted to look at actuarial data within Lake County and then also Chaffey County. So we requested Peak Health Alliance to come in and do that work. And so that's how this all got started. And that's where we are today. And in the meantime, they've negotiated with St. Vincent's and local providers here, and Tamara's providing this report. But that's how it initially got started through the Lake County Community Fund. And then the cost that they've incurred for this work in Lake County is $10,000, as I mentioned, and we've received a grant from Freeport McMoran for $5,000, and as Greg mentioned, the city's committed $2,500. So we're trying to reimburse Peak Health Alliance for the work they've done already on the ground, which is $10,000.
And with that reimbursement, then does that, do we continue outreach to those local businesses and folks to help them understand, the negotiating power or the representation that you can offer?
Yeah.
Offer those organizations?
Mm-hmm. Yep. I mean, our work, quite frankly, the work is done. It will continue regardless of this decision that you all make today. It's just that we did incur costs as Peak Health Alliance, and we typically ask our partners in the communities that we're working to help us defray those costs.
It seems like something worth encouraging that outreach in the community. And while, it might, it's possible it might not be suitable for the county government to make any changes, but it seems like it may be suitable for city and small businesses to be able to tap into Peak as a resource. John, do you have a comment on that?
John, you're still muted. Oh, there.
Yeah, there you go. Yes, absolutely. I mean, this is something for small businesses, individual families. Tamara, in your data, there's an estimate. What percentage, was it 15% that are uninsured in Lake County that you?
Yeah, it's around there. It's fairly high. And interestingly, only about 1% of the total care stays at St. Vincent's. The biggest bulk of your care ends up at St. Anthony Summit Medical Center in Frisco. And then there's, off the top of my head, I can't remember what the percentage that goes down to the Front Range. So this is a pretty significant opportunity for your hospital as well.
Okay. And so what you're asking for us to do today is to partner with the city to make up that $2,500 for the work that's been done in Lake County. Is that correct?
Correct.
Yes, yes. And then this would be a match with Freeport McMoran for their $5,000 that they've committed.
Okay. And Greg, the city's already committed to this work?
Yes, that's correct.
John, did you partner with the EDC for this project as well? How informed is that group on the effort on behalf of businesses?
No, did not. But I think moving forward, this is something that's absolutely they need to be involved with moving forward.
Tamara, is this is that an organization that you guys tap into?
We do typically. Yeah, I mean, again, we really want to rely on our local relationship, right? Not be the kind of heavy-handed gorilla that comes in and says, well, you must partner with this, and this entity. But typically in the communities in which we work, the chamber or the economic development entity is a partner at the table in this work, because we recognize that their relationships with the small business community tend to be the strongest. So, Summit County's chamber has been a partner from the very beginning. Grand County's chamber has been a partner from the very beginning. Same actually in the Southwest, those chambers have been partners from the beginning.
Tamara, I don't know how to best ask the question, but because you guys are brand new in the industry of doing this, what does your network look like? And is this HMO and PPO or just PPO?
Yep. So for our self-funded employers, it is HMO and PPO. Employers can offer both. And actually, if they want to offer the narrower network, or if they want to offer the broader network, then we also ask them to offer the narrower network, because that's better for the the rural hospitals, that scenario. And for the self-funded employers, the networks are really built by the TPAs. So we don't offer a network. What we do is we take those highest price drivers and we negotiate with those entities. And then it's up to the TPA to really build the network around those contracts. So for example, we know that PT tends not to be a cost driver or a price driver. So if UMR were your TPA, they would use their existing PT contracts to complement whatever contracts Peak negotiates on behalf of the community. I know it's often a concern of employers that they'll end up with a narrow network that limits the choice of their employees. And certainly if an employer chooses to do that, they're going to generate the highest level of savings. But we also recognize that for municipal employers and government employers in particular, that is often difficult. And so there is an option in which really, you can craft whatever network you want to craft with your TPA.
Tamara, I'm sorry, I keep saying your name wrong.
That's okay.
Tamara, is that right?
Tamara.
No, Tamara, not Tam. Okay, Tamara. Moving forward through the next, is this for fiscal year? No, sorry, this is to cover previous work that you've done. Mm-hmm. Moving forward annually, what does a partnership or commitment look like?
There's no ongoing financial commitment to Peak. So the way when an employer or an individual purchases a Peak plan, there's a small premium that comes back to Peak to fund our ongoing work. And in fact, in a number of our communities, we're actually going to be able to generate enough money to give some money back to the communities to cover their initial financial investment. That conversation is really based on enrollment and how many lives there are in a particular community. But we anticipate that Grand County, for example, is going to get a significant amount of their initial contribution back next year because of the number of plans or residents that choose to buy in to Peak. But no, there is no ongoing financial commitment from a community to be engaged.
And have you yet gotten any other, gosh, the word is escape, any Lake County folks or businesses purchasing?
No, so we won't, enrollment typically doesn't start until the fall.
Okay.
So we won't at this point. In terms of larger employers that are members of Peak at this point, Grand County government is a member, Summit County government is a member, Town of Breckenridge is a member. So those are actually our three largest employers at the moment.
Okay.
Mm-hmm. And Grand County government actually anticipates that by joining Peak, they will save somewhere between $300,000 and $500,000 on their premiums this year.
And the city of Leadville is going through that analysis, has started that analysis now.
Yeah.
Is Peak doing that analysis for the city, or Greg, are you guys?
No, we're talking directly to the TPAs.
Yeah, it's usually the TPA and whoever you use as your broker consultant that does the analysis.
Okay. Commissioner Glenn, do you have any questions for Tamara while we have her on the line?
No, I don't have anything.
Commissioner Marjorie, do you have any other questions?
I don't have any other questions. No, it seems like it's a good, the community fund reached out for benefit to individuals and small businesses, and I'm glad we can expand opportunities for those folks. And I'd be interested to have our HR speak with Peak to see just what the benefit may be for our engagement or enrollment, of course, and to have that analysis done as well. But I don't have anything else.
Okay. I don't think I have anything else at this point either. When would you need to have a decision from us by tomorrow?
In terms of the donation or in terms of the health insurance enrollment piece?
Sorry, both.
Both. Okay, so the donation is really up to you all. We've already incurred and paid for the costs, so this is really just helping to make us whole over the long term as we begin to look at counties in the future. In terms of enrollment, that really is going to depend on what your plan year is. If your plan year begins January 1st and your open enrollment is probably October, then we would want to start having conversations fairly soon.
Okay. Wonderful. No further questions from my fellow board members before we move forward. I think I just want to digest on this a little bit before committing to something like a donation or something of the sort. I think I just need to digest it a little bit to understand it a little bit better, and then can determine what do my fellow board members feel.
I'm okay with that. I would love to better understand how to, be a conduit for the work that you're doing here to individuals and small businesses. So maybe, I don't know if that's John giving us more information or HR speaking with Peak and helping us better do that. But I want to support that work and kind of that advocacy on the part of the community. And I'm happy to make that decision now or at one of our next meetings on the contribution.
Yeah, certainly would love to work with Tamara in providing more data and getting the information out to Lake County. So that would be just great to do that.
I do have a study that the Colorado Health Institute did about our work that I'm happy to share that might give you all something
Sure.
to read to digest if that's helpful. I will send it to John to share.
Great. Yeah, it'd be great to have maybe public health and human services here as well too, to learn about what they could be offering, because I'm sure that's kind of that might offer opportunity to them, correct, in kind of helping folks enroll.
Mm-hmm.
Sure. Wonderful. So do you think we could, did you want to make I'm sorry, Commissioner Glenn dropped off the meeting today. I figured that would happen. He has an appointment that he needs to get to. Would you feel comfortable making a determination on the contribution today then, Sarah?
I would.
Okay.
But if you're not, then I mean we can discuss it next week after reading.
Yeah, I think I'd kind of like to read through that information that you could send to John tomorrow, and then we can let you know next week if that would be okay and be appropriate.
Sure.
Okay.
Thank you for your time, Tamara.
Thank you for having me. I appreciate it.
And thank you for the work that you're doing. It was really good to have you here to explain that to us.
I'm happy to, and feel free to reach out if there are other questions I can answer at any time.
Okay,
Perfect.
wonderful. Thank you.
Sure, thank you.
Thank you all very much. Thank you very, very much.
Thanks, John.
Yeah.
All right. So I think that leaves just the minutes on our agenda today.
Mr. Marcella, before you jump into the minutes, can I have just a moment of your time?
Yes, absolutely.
Thank you. Something came up in City Council, and I'm not quite sure where we're going with it, but I thought I'd bring it to you as well. We had a City Council member who was very concerned about the safety on Highway 91. And he seems most concerned about entrances to trailheads. And that's where that awful accident happened last week, where we had a death. And he wanted to know if the city and county would, let's say, co-op on a letter to CDOT asking them to mark some of the trailheads, the turnoffs to trailheads off of Highway 91. That's the request. City Council seemed generally to support it. I'm just not sure. Highway 91 is not in the city, so I would think it would need to be authored by the county with the city signing on to it, something like that. And I'm not asking you for a decision right now. I just want to bring that up and say that was a concern and a request from a council member.
Mayor, I'm sorry, can you reiterate, was the letter to CDOT to look at all trailheads and looking at safer, or is it just in that area of 91?
I think it was just in that area of 91 where the traffic is so fast. But I would say in our county, on our side, there are several places where people, we know in the wintertime, especially Chalk Creek is a big assembly point for snowmobile users. We know the turnoff, and I guess this happened, I didn't know this, is the turnoff to the Sangre Hut trailhead where that accident happened. And then another place is up near Stork Curve, where people go, up the valley there. That's more of a winter activity as well. But those are the three on our side that seem to be problematic in terms of people slowing down or stopping and turning. And I don't know what obligations CDOT might have to marking those trailheads or those places where people gather. But it's just, if you would just give it some thought, maybe I'll talk to you next week about it and see if that's something we could do as a city and county.
Greg, Mayor, we also have the IMTPR meeting is next Friday. This would be a great thing because I don't think there's any harm in advocating for greater safety on that,
That's
especially with
a great idea.
increased
traffic. The 17th?
Yes. Yep. The virtual information has not gone out yet.
Okay.
But I can definitely share that with you and Mrs. Dallas, and then we can spread that to City Council. And if I can, I don't think if I can see that letter, I will definitely bring that to their attention.
Well, we haven't done any letter yet. This was just, at this point, it's a thought.
Okay.
So, but that's a great idea. Thank you.
Yeah. Yeah,
Okay.
no, that's a place to do it. So
We would
get on a list of projects at least.
Okay,
So-
thank you very much.
Yeah. Sounds good, Greg. Thanks for bringing that to our attention. I appreciate it.
Mm-hmm.
Because I definitely think it's something of consideration. There's so many people that commute over that road every day. The safety has always been a big concern. So, thanks for bringing that up. So now we'll move into the minutes. Commissioner Mudge, have you had an opportunity to look through the minutes?
I looked through half of them, Kayla, and I apologize. I know this has been dragging, so I will commit to completing that for a meeting next week, unless you'd prefer to look at those during this meeting together.
That's okay. Could you send Patty and myself any edits that you have so that she can at least get the ones that you had looked at edited? I think that part of the problem is that she had been waiting on edits from us and had not had an opportunity to make those. So if you had edits to give to her, if you'll send those along to her and I, just of the half that you've done, that'd be great.
Okay.
Awesome.
I will do that.
I think Patty, just FYI, we're gonna try to set up a special meeting on Monday to make some of the determinations on staffing. Sarah, does that sound appropriate to you? Mm-hmm. I don't see that either one of us have anything on our calendars for Monday, so maybe if we could just block out a chunk of time Monday morning.
We could do Monday, or does Tuesday's work session have a bigger agenda other than the public health update? We change that to a special meeting, or?
No, I don't. I have a meeting with the URA at 2:00 on Tuesday.
Oh, okay.
So if we could just do it like first thing Monday morning, I think that would be great. And then
Sure.
if you can commit to getting the minutes done potentially tomorrow, and we can approve those on Monday.
That sounds good.
Okay. So Patty will do that. Sarah will send you and I her edits that she has on what she's gone through so far so that we can have those prepared, and I'll be here to start signing once they're approved on Monday, and we'll put something on the planner for Monday as well.
Okay.
Does anybody have anything else before we go? Amber, I'm going to connect with you with a scoring rubric so that we can get rolling on that and make that determination as well.
Okay.
All right. Nothing else today, everyone. I think we're good. All right. So with that, we will adjourn at 2:04 p.m.
Thank you.
Thank you.